Hi guys, welcome to Shine with Njoki Kamanja. Thank you so much. You're a good person because you press play, meaning you're in the right channel. Thank you so much because you have been supporting this channel. I have seen new subscribers because we learn, we inform you, and sometimes we laugh because as much as we are learning, we need a good laughter. So today we are going to be connecting with our Daktari who is teaching us about this area, the pelvic floor. And today she's teaching us about one of the disorders. And I'm not going to give more details because am I a Daktari? No. So let's get into the video and learn more. So now, today you told us we are going to be talking about the fecal incontinence.
Yeah.
Explain to us what you mean by fecal incontinence.
Okay. As we said last time, incontinence is that inability to hold. So it is inability to hold either urine, gas, you know. So fecal, today we are dealing with inability to hold the bowel matters there. Inability to hold, it might be the solid matter, it might be liquid matter, it might even be gas, which a lot of people don't know that when you cannot hold gas, you are having a rectal incontinence. Did you know that?
Oh.
Yes. Okay. Yeah, when you can't hold gas, you know, it's a natural process.
Yeah.
Yeah, it's called call of nature. So when nature calls for you to pass gas, you have first of all to check where you are. Is it appropriate? Is it not appropriate? And then you will decide.
Yes.
This is the appropriate
this is
time.
the moment.
Yes. Then you do it and you feel very good.
It's the best feeling.
It's the best feeling, sure.
Of course.
And that is why you say you feel relieved.
Yes.
Yes, exactly. So even gas is still, when you cannot hold gas, is a form of fecal incontinence. And this reminds me, when I was growing up, we used to use matatus a lot.
Yeah.
Even now we use matatus, yes. Face me.
I face you.
And then the normal ones came.
Yeah.
And then sometimes when you're traveling, you wonder, is it your neighbor or who is, you know?
And if it's your neighbor,
amekauka. The only person who is always looking ahead is the suspect because everyone else is
looking what is happening.
So, and you wonder, and some people would think surely how mannerless, how mannerless people are, not knowing maybe that person cannot hold. It comes and just passes, comes and so you will be wondering, even if it's your neighbor, why weren't you taught manners? You know. And so you can imagine if you're passing it and you cannot hold it and you're using a public means, how would you be feeling? You yourself, the one who's passing it?
Very bad.
Very bad. Which means even most of the times, you will only travel when it's very necessary.
Yeah.
True? So definitely, again, you can see now how we will go deep and say how it impacts on even what you call quality of life.
If you cannot hold gas, then is there a problem if you hold it so much? Because now, let's say I'm moving from Nakuru to Nairobi.
Yeah.
Every time I feel the urge, I hold. Isn't it now an issue then?
Okay, you know, you cannot be feeling like passing gas like throughout. And definitely that is why we also even have stopovers. We are told, they call them stretches, people to go and stretch. And when people are going to stretch, you'll see people standing in different corners.
They are stretching.
That is the stretch. They are doing the stretch everywhere. You stretch, you stretch, you feel nice.
You release.
You release. Because when nature is calling, it's good to respond.
Yeah.
But you can hold. You can hold. Because if you hold too much, that is when you'll start feeling a feeling of bloating, feeling of, you know.
Yeah.
So there is that limit that you can take. And our body has that discipline of knowing, we are having a meeting for the next 1 hour. So before you start meeting, go and do the necessary, clear your bowels if you need to. Then you can hold for the next 1-2 hours. Okay. You know, it will not affect you.
Yeah.
But if now the way people travel long distances, that is why people now start getting bloated.
Yeah.
Because you are holding so much in your... Yeah, and you remember last time I talked to you, I told you about how we should be thankful for those activities.
The analogy you gave
yes.
us. Yes.
And that is why when maybe you went through a surgical procedure, maybe a major one or even a semi-major, before you start eating and taking a lot of heavy fluids, your doctor will come and ask you if you've started passing gas.
Yeah.
To know the system is back
to
normal. You know, so those are normal processes.
Wow.
And they are good because they tell you your body is in shape.
Okay.
Yes.
So how common is this issue of the fecal incontinence?
Fecal incontinence, we can say about 7 to 15%, call it the prevalence. 7 to 15% of adults have had that issue. The problem is so much underreported. It is so much underreported. It's one issue that is so much underreported because Njoki, I told you, issues pelvic floor are quite private. Yeah, that is why you will see people sitting well and adjusting. Yes, and adjusting and you know, because people feel these areas are like so much private, which is true. Yeah. So I told you, anything that also happens down there, a lot of people hide. Yeah. I know of a case of a lady who had that issue, and the husband never knew. It was her top secret. Oh. Her top secret. Even she was asking us if we can get those pads for that kind of a problem, the special ones. Yeah. Yeah, because she was feeling it is such an embarrassment. Yeah. And it really had to take a lot of talking to her and all that to be able to open up and to realize it's a condition. Like the way I would have any problem even with my hand, my head is aching. Yeah, we had to make her understand it is not out of your making. Yeah. So it's quite common, but very much underreported. You can imagine your spouse having such a problem and you are not aware. So it is so much underreported, but it's common. And it's common in both adults and children. And actually children, some of them, some parents might think it's a stage of growing. Yeah, because at a certain stage, a child is supposed to be well potty trained, you know. Yeah. So when a child is still going to school and they cannot still hold their poops, they come with pants which are dirty almost all the time. Once in a while, you know, maybe they went and they didn't do a good job. Then there is an issue. So some parents will still think the child is in the process of growing, but it's actually a problem. Okay. Yes, it's actually a problem. Wow. Yes.
Now let's talk about the causes, and as you give us the causes, now you've touched on now the children.
Yes.
Me as a parent who don't know about this condition, and my kid maybe has it, how do I even know
that your kid has that problem? Yeah. You will know your child has that problem, because first of all, the age allows that child to have been well potty trained, you know. Yeah. But every time maybe you're going to clean their clothes, you find some poop. Yeah. Every time you go to, you find some poop. You know, that is an obvious sign that there is a problem. Yeah. Because most of them will not tell you that they because they don't know so much whether it's you know. And some of them who are a bit grown, what they do when it happens, they throw their underpants. You know. So when they realize that has happened, they throw their underpants, or sometimes they will even hide it under the beds or just some place. So you will just be feeling there's some smell somewhere. Then you realize. And you know, some parents will not understand. They will even beat them up, asking them, you are now a big child, why are you doing this? You know, but it's very, very common. Okay. It is very, very common. So that is the best way to know from checking your, because if it's not there, it means they are not most probably having that problem, you know. So that is the easiest way of getting to know there's a problem.
When it is frequent, not like once.
Not when it's frequent, definitely. Okay. Yeah.
So let's now talk about the causes of this condition.
So the causes are varied causes, yeah. So I would say the first cause first of all, your muscles must be strong enough to be able to hold. You know, they must be strong enough to be able to hold. So if your muscles are not strong enough to hold, then when it comes, it will seep. You're getting it. So that is one cause. Muscles that are not strong enough. They are called the pelvic floor muscles. They are the muscles that when they are controlled by what we call the sphincters. We have sphincters. The sphincters I told you are those like when you blink your eye like that. Is the sphincters. And we have which are two types: voluntary and involuntary. So when we talk of involuntary, you can say it is in. It's easier to remember it like that. It is in. So when it is in, it's very hard to control what is now in us. So there is a way it communicates with the external one. The external one now is voluntary. You get it? So the poop will come down. Then it knocks. It knocks. Yeah. Knock. And so your nerves, which is also another thing that needs to be intact. Your nerves have to, the integrity of the nerve has to be good. So the nerves will start to sense that there is a visitor coming. And so if it's the right place, you will welcome the visitor and go and poop. And if it's not the right place, that is when you tell yourself, the external sphincter tells the internal sphincter, they communicate and it holds. So when there is a problem, it will come, and maybe even the sensation is already poor. Getting it? That is now in the integrity of the nerve is not very good. So you don't even know it's coming. It's coming, you know. So it will just come and go, and the next thing you have it's the out. Incontinence. It's out because even the sensation is also poor. Then the rectum, because the outside is called the anus. Now inside there is the rectum. The rectum, it has to have the ability to hold. So like Njoki, it has come, the poop is coming, and your rectum cannot even expand and try to accommodate it, and it's already coming. So you see, that is also another problem. That is another problem. Then your body should be able to sense what is coming. And I know naturally you will agree with me, you have felt it. Naturally you will listen to the man body behind there. I'm feeling something. Then you will feel that one is gas. And you're alone in the bathroom. You let it go. And you feel very nice about it. Then you will again feel, maybe you're even sleeping. You thought it's gas, and you want to let it go, then you realize, hey, this one is going to be bad. And then you jump out of that bed. Hey, you always jump. Now that is liquid. That one is now liquid. You almost release it. You're like, hey. There's very good communication between the brain and every part of our bodies. Very good communication. And the way you wake up, it's like you've been beaten by something. And if you are so sleepy, you find yourself in the toilet. Then it's also able to detect, you say, that one is a mass. And Mimi, I'm not going to the loo now. You hold on. So it's able to know that one. That one we can hold. I'm not feeling like waking up. So your body should be able to be able to feel all that. It should be able to feel all that. You know.
So you've said one cause is that muscles that are weak, the nervous system down there is not sensing. And then the other one is the one you have told us, that the rectum.
It should be able to.
It should be able to hold and also to sense what kind of
Yeah.
matter
The
is
other
being
causes,
released.
Njoki, which are obvious, diarrhea.
Mm.
Diarrhea. You know cholera.
Mm.
Cholera. I remember when I was small, I used to be to see young. Even sometimes they do it when it's very bad. Because you know it comes uncontrollably. You can't control it. They put a hole in your bed, and you face down, and something is under, so that it comes and goes. So that one is incontinence plus at that time, because your muscles can't hold it can't. Everything is has flared up. So that is another cause. Some surgeries around that area, and then some diseases, cancer and all that, some diseases. And then also even sometimes we say when you age you shouldn't age, and incontinence should not be told it is normal. But sometimes the aging process, some people might have the kind of muscles they have. You know,
yeah,
the
you
kind
told
of
us
muscles.
when the older we get, the weaker
Muscles,
the muscles.
yes, exactly. So you might find some people, their muscles are quite weak as they age. They become so weak that they cannot hold. Then we have even the kind of muscles that you inherited. You can,
inherited.
Yes, because the way we are made, you can look at our maybe even our skin and the skin of maybe the Caucasians, the way we age somehow differently. You are getting it. So our aging process is also different, you know. So even in my family and your family might also have the same kind of a thing, you know. So you'll find your family has that kind of muscles that
they're not strong.
they're not so strong. So all those causes might have had an accident around those areas, you know. And then even sometimes during birth might have gotten an injury, and a big episiotomy that did, you know. So birth defects, those are some of the causes that cause fecal incontinence.
Let's now talk about the types, because when I heard you explain, you were talking about passing of gas. You can pass liquid matter or solid matter. I don't know whether this plays part when you are naming the types of incontinence.
Okay, we have different types, the way they present themselves. Let me say the way they present themselves. We have what we call a passive fecal incontinence. Passive, even from the name, is it came and you didn't know. So, you know, you didn't realize, and that mostly occurs when your nerves have a problem. You know, like you felt I touched you. So, you know, you can sense. So the sensory nerves, they have a problem. So it comes and passes. Or sometimes the muscles had distended so much. You know, there was a problem, and the distension of the muscles is so much. So it can easily allow the fecal matter to seep without you realizing. Then we also have another one that resembles what I was telling you in urinary incontinence, the urge. And the name can tell you. The urge is when Joki, you're seated over here, and it comes, and the urge is there.
And I leave you here and go.
And you leave me here and you go.
I'm not even asking for permission.
Yes, exactly. That is the urge, you know. I have to go. And what makes me want to laugh is small children. Sometimes when they have it, because then it's because they delayed, you know. They go on the last minute. They were playing until the last minute. So you can imagine. So that is why they get the urge. And even the action they do, most of them you will see them holding. I've even seen some adults, and you know, you wonder, does the hand become now the sphincter? When you do this, are you really holding?
They are closing the door.
Because when they touch over down there, it's like they are closing it.
To prevent.
Thank you. I wanted you to mention that point of the mind. How powerful our minds are. How if you're able to hold like this and the mind tells you now you are good to go, nothing will come out. that can also help us in so many ways. The mind can help us in so many ways.
Okay.
So that is the urge, yeah, the urge incontinence. We also have what we call fecal seepage. Fecal seepage is almost similar to passive, but now this is where you can feel it, but you cannot control it. It is passing.
So the nerves here are very much alert.
The nerves, yes.
They are very much alert.
But now the muscles might have a problem. Or sometimes, you might, some people think when you're constipated, you cannot have that because someone will tell you that I am not diarrheaing. It's actually because they are constipated. So when they are constipated, they had fecal matter. When now the loose one comes, it seeps. You get it seeps around there. The one that is already hard. The one that is already hard. And lastly is the gas. We were talking about the types. The gas. So we already talked about the gas incontinence. This is where gas just comes out. You can't hold, because the muscles are not able to hold, and the sphincters are not, the internal and external sphincters are not communicating very well, and you are not able to hold. Okay. So those are the types. Yeah. So
a patient has come, and you have done your test and you have realized they have this condition. What are the many treatments or the few treatments that you people give for this condition?
Okay. So Jackie, I told you in medicine last time, we do what we call the multidisciplinary. Yeah, mostly it's always good to work with other clinicians, other physicians, other practitioners.
Yeah.
Because some are our cases, some are not our cases.
Yeah.
So first of all, most probably the person would have gone to the clinician. Then the clinician, after checking, they realize this person is maybe they have poor habits. Yeah, you know, even poor habits. They can cause. I didn't talk about poor habits. Yeah, some of
poor
the
habits
points.
is the one you told us that you just see a toilet, you want to enter.
Yes, poor habits, or even the habit of overholding.
You follow them,
or the habit of overholding. And also there's also a habit. I had a case here of a young boy of about age 12. Was he 12? I think he was about 10 years. 10, yeah, about 10 years. So this boy, he comes, the father tells me the way every time they find some fecal matter in his underpants, and sometimes even in school, the teacher has to send him back home to go and change. And you know, it's also very embarrassing to the child. Yeah. And the child was even becoming very shy. He didn't even want to talk to his friends were starting to isolate him. So when we came, I asked him about what happens. So first of all, you have to get a very good, you ask the questions, you know, the
like
history.
You are taking history.
The history taking, you take very good history. What happens when you go to the toilet? How does it come? Do you run? You know. Then when I decided now I want to do now an internal examination. And when he came, first of all, you tell them to clear their bowels. Yeah. So they go to the toilet. Maybe you even want to make yourself a bit clean, clear the bowels for the examination. So when he came, and the father also tells me when he was coming from home, he had actually again gone to the toilet. So when I go in, I realize he still has the matter inside. You know. Then I realize he's going to the toilet, but he's not clearing. You know, he's not clearing the fecal matter. And so we start our journey from there. Then I also realized there's some muscles. The muscles were strong, but from my assessment up to a certain level, there's a way we group them up to around 5. So I realized he's around 4. So a bit of weakness plus poor habits. So maybe because of that weakness, he was not giving his all to to completely clear.
Okay.
So I started immediately. You start on it's like potty training. You start teaching him. When you go, this is what you do. You even teach on sitting positions. Yeah, that is part of our treatments. How you sit. Yeah, you know how you sit. If you like going in the morning, train your mind that in the morning when I wake up, maybe take a glass of water, go to the toilet. If you like even reading a magazine, sit and enjoy. You know, it's such a nice process. Yeah,
of course.
It's a nice process. If you give it time, you will enjoy
some
it.
Music with
some music,
earphones.
yes, and some earphones, and enjoy what is happening. You know.
Yeah.
So I taught him how to make sure he clears his bowels completely. Take your time. If he was waking up 10 minutes to 5, let him wake up like 10 minutes earlier so that he has enough time to go to the toilet. So we don't tell him you're getting late for school, so that he has his time in the toilet. And I can tell you it was as easy as that. And it's a problem that boy had stayed for a long, long time. So that is what I was trying to say about the poor habits. Sometimes it's just the poor habits.
Okay.
So that is now what I was saying. The doctors will check if maybe it's other conditions. Maybe it's a tumor. Maybe they need to go for surgical. Maybe they need just medication.
Yeah.
You know. And if they find it's a case that involves us, they will send the patients to us. So when they come over here, we will assess and know where is the problem, what is your problem. First, sometimes it is just poor habits. We train you on proper habits. Yeah. Maybe even the foods you are eating are the ones which are causing you even to have very loose stool and all that, so you can't hold. So we take you through the process of how you eat, whatever you eat. Then even how you sit in the toilet, and Njoki will be surprised.
There's a way you should sit,
and it comes some things naturally. You will find that Njoki, when maybe you feel you're straining, there is a position you will take. You will find yourself trying to bend. So that's a good position. Anatomically, there is what we call an angle. There's an angle that you're trying to create that will help you in pushing. So you create a proper, so that inside there, because the muscles inside there, when you're poo-pooing, they relax. They relax. They completely relax, and that is why you enjoy it. They relax. Then the outside ones, now they contract. You know, so they work together. So there are even some people who do not know how to poop. You even have to teach them the process of how you do it. You know, how you do it, so that you completely clear the bowels. You know, so you teach some of those things. If the muscles are weak, you have to start teaching them on Kegel exercises. Get to identify which muscles are weak. Is there a problem that these muscles are weak? You know, get to know maybe the person is obese, need to reduce your weight. You know, different. Get to know where is the problem coming from. So you work as per the problem. Okay. Yes, I hope I have answered your question.
Yes, you have, because I've learned that sometimes the patient might not be your patient. Maybe they would require another specialist. And if they are brought to you, you will have to learn first this condition lies where. Does it lie on them doing Kegel exercises? Does it lie on them having surgery? So it depends with the condition and how far it has come.
Exactly. Yes.
See, I'm a good student.
You are a perfect student and a good teacher to be.
Yeah, start teaching these things. So we have learned a lot, and I didn't know that even kids have these conditions. Then because now I'm a parent, maybe I'll be more observant.
Yes, please.
Yes.
Please.
Thank you so much for teaching us about this condition, and maybe you can repeat again where this place is, so that people can locate it easily.
Before I even go to saying where we are, Njoki, what I want to tell our viewers is don't be ashamed of a disease. Seek help. There is help. There is help of almost any condition that you may be having. Come out, talk about it. We are here to help. If we cannot help you here, we will refer you to the right places. So don't stay with your problems. If you have any problem to do with you can't hold your gas, you can't hold the poop itself, or water is seeping out, come and see us. We are in Muthaiga Square, Thika Road, the tall building opposite Muthaiga Police Station, first floor, room 3 and 4. Karibu sana, we got you.
Yes. You know what, we got you. Thank you so much for teaching us, for even accepting us to come and shoot with you so that people can learn, and even talking about these conditions that mostly people don't talk about. Sure. And we are so grateful. And I'm loving that this channel is becoming a channel that we talk about those things that people feel uncomfortable about.
Yes.
So thank you so much. I am still waiting for the one about erectile dysfunction. Somebody told me he wants to know about it.
About erectile dysfunction.
Yes.
Don't worry.
Yes,
we shall discuss it. Yeah, we will teach the community about it, and especially teach them not to be scared of any condition. Yes.
So thank you so much for watching this episode. This is Shine with Njoki Kamanja Kethi. Remember, you're the light and you can shine, and do not keep quiet.
Shine with Njoki Kamanja Kethi.